breast cancer. It is 1 in 4 of all cancers diagnosed among women worldwide. Breast cancer has become a major health concern across Indian cities. Metropolitan cities like Delhi, Bengaluru, and Chennai account for more than a fourth of all cancers diagnosed in women. In India, one woman gets diagnosed with breast cancer every 4 minutes and one woman dies of breast cancer every 13 minutes. It is the most prevalent cancer and the leading cause of death from cancer among women. The lifetime risk of having breast cancer in Indian women is 1 in 30 in rural areas and 1 in 60 in urban regions. Breast cancer among young women in India is actually 4 times higher than in the West. Alarming, isn't it? Breast cancer can occur in men, women, and transgender people. There are many reasons that trigger it. Early menarche, late menopause, delay in the first pregnancy, family history, sedentary lifestyle, stress, fast food consumption. Any of these could be the reason for one to get cancer. And not to alarm you, but breast cancer is not limited to a particular age group either. It affects young children too, but only in rare cases. Over 50% of breast cancer patients in India seek medical intervention only in the 3rd and 4th stage. Young breast cancer patients avoid going to the hospital for diagnosis because they are shy. So, they mostly get diagnosed in the advanced stage, which impacts their chances of survival. Most of the breast lumps are benign or non-cancerous. Only a few will turn malignant, which means cancerous. But one should see a doctor to identify if the lump is benign or malignant. Experts say anyone from the age of 20 should frequently self-examine their breasts and check for lumps.
What we do is generally one must not clutch the breast just like that. So it's important to use these 3 fingers and press the tissue of the breast against the chest wall. So the breast tissue is soft, the underneath chest wall, the ribs are hard. So you press it against that to see what can you feel. And it's usually done starting from the collarbone right up to the lower border of the breast, that is in the vertical direction, and from the midline, that is the sternal bone, right up to their underarms. All that has to be examined. It can either be done in the way that I told you, that is, up to down, medial to lateral, or it can be done in a concentric pattern starting from this. So if this is the nipple, they can just continue to feel themselves around the nipple like this, concentrically around the whole breast.
The management of breast cancer requires multimodality treatment options such as surgery, chemotherapy, radiation, and hormone therapy, which don't come cheap. Most of the time, the expensive nature of the treatment discourages patients from seeking medical help. Around 90% of patients in high-income countries survive for at least 5 years after diagnosis, while the percentage drops to 66% in India. When someone is diagnosed with cancer, it changes their way of life forever. Although chemotherapy is one of the main weapons against fighting cancer, its effects on the body are not easy to deal with, especially for young women. Chemotherapy is the use of drugs to destroy cancer cells. It usually works by keeping the cancer cells from growing and dividing. The drugs used for chemotherapy are powerful and can damage healthy cells also. The damage causes side effects like hair loss, loss of appetite or weight changes, nausea and vomiting, and diarrhea. For younger women, changes in periods are common side effect of chemo. Premature menopause and infertility may occur and may be permanent. A recent study, however, says that cancer can be treated without chemotherapy. Does that work for breast cancer too?
Definitely that's possible, breast cancer also, but then we cannot generalize it. So today, if you have 5 patients with breast cancer sitting in front of you, each of them will have may have a different kind of cancer. The decision about whether a patient requires chemotherapy or not depends on the age of the patient, depends on the grade of the tumor, depends on the lymph node involvement.
The COVID-19 pandemic has undoubtedly affected millions of people living with breast cancer. A few patients even had the misconception that COVID-19 is more dangerous than cancer and skipped therapy. Patients with painless symptoms in the initial stages also delayed treatment, waiting for the restrictions to ease. But as the second wave wanes, it is time to take charge of our health and focus on breast cancer awareness. Very few know that the increased risk of getting breast cancer is a preventable condition. This October, let's all pledge to learn, follow, and teach breast care. While most of us are aware of the causes, signs, and symptoms of breast cancer, we still forget to take appropriate steps, modify our lifestyle, and act accordingly to detect the disease in its earlier stages. Of course, the spread of breast cancer awareness has progressed, but still there is a long way to go. Nisha P.S. from Chennai for the Federal.